Hi, I'm Diane Marseglia, Chair of the Bucks County Commissioners. I'm here with my colleague, Bob Harvey, today, as well as Jim Worthington, who owns this building, and several people from Newtown Township, and our Director of Emergency Management, Scott Forster. And basically, before we start today, I just want to say how thrilled I am that Jim Worthington is in our community and has been such a good neighbor and friend to everyone. He called me a month ago, maybe, and offered the use of this building and has waited patiently to decide if we needed it. And in fact, we have reached the point where we believe that we need it. So we are very grateful to Jim and really grateful for all the people that are going to help turn this into a convalescence place where people can get healthy again. I'd like to introduce Bob Harvey, my colleague.
Thank you very much. Thank you for being here. I just want to echo a lot of what Commissioner Marseglia said. One of the things we've seen through this difficult time is the volunteerism, not just in Bucks County, but around the country. We've seen people coming out, helping people in need, and this is really a time when we need to, those people who stand up really are heroes, in addition to all the other people who are going to work every day, doing the essential jobs, the healthcare providers, our nurses and doctors and firefighters and EMTs, everybody else that's doing that. Obviously, they're critically important to this. This will eventually be staffed by people, some of them volunteers. Medical Reserve Corps is what we call them. People who, many of them retired, nurses and doctors who have medical training. But what Mr. Worthington's doing, obviously, is another level of volunteerism. And it's not the first time he's been this generous, but we certainly thank him for everything he's done. I'm going to let, Scott Forster talk a little bit about how this will work, and then Mr. Worthington will speak. So.
Thank you, Commissioners. So I want to take an opportunity to tell you today that we're turning this sports training facility here at the Newtown Athletic Club into a Tier 2 and a Tier 3 medical care facility. This facility will have approximately 80 to 100 beds. And if you could picture a patient in a regular medical surge bed in a hospital on a regular floor, that's the type of patient that we plan on treating here. Individuals who may need additional oxygen support, individuals who may need intravenous fluids, and people who are just in need of additional assistance so that they could get back to health before they can go home. At this point, we have plenty of bed availability here in Bucks County. As of this afternoon, we had 400 medical surge beds still available in our hospitals. We had 50 ICU beds still available in our hospitals. But as we know, the numbers of people continue to get sick. We don't know that we will need this facility, but the time that we know that we need it is not the time to get ready for it. The time to get ready is now. And the county staff, along with the Newtown Township Township manager, has been very supportive, Micah Lewis, as well as Glenn Forsythe, the Township Emergency Manager, and a lot of the county staff has put a lot of time into the facility, working with Mr. Worthington to ensure that we could get this place ready. We are working on things like alternative generator power for the building. We are bringing in all of the beds and medical supplies that you see behind us. About 3/4 of the facility is set up, but we will be bringing oxygen concentrators in. We will be bringing other types of supplies in to be able to take care of the folks that do come to this location. I hope we don't need it, but let's be ready if we do. So I'd be happy to introduce Jim Worthington and see if he wants to say a few words.
Thank you. Well, briefly, I'd just like to say for 42 years the community has supported both myself and my family, and I get a little emotional, but it's the least we could do. Really, the NAC has always been about, and what we've done is about helping the community and making a difference and making lives better, and I can't think of a better way to chip in and help our community than work with the Diane Marseglia and her team here. And we're just blessed to be able to be in that position. I thank my staff for all the work they've done to help make this happen, and we're proud to step up, just like the community stepped up for us over the last 42 years. So thank you, and we're thrilled to be doing this.
You have any questions?
Will this just be COVID-19 folks coming in?
That's the
So this building will be set up in 4 quadrants. We will have COVID-19 patients and non-COVID-19 patients. Whatever it would take to alleviate some of the stress on the hospitals when they are at capacity and when they are surging, that's what this facility will be used for, as long as they fit into the type of quality of care that we could provide here at this facility.
Can you describe what Tier 2 and Tier 3 is?
Sure. A Tier 2 patient is someone who normally can stay at home and take care of themselves, but they have underlying medical conditions. Maybe they're on home oxygen, maybe they're a diabetic, and they have to worry about maintaining their sugars. But because they're a COVID-19 patient, they may be more lethargic. They may need a little extra help in doing that. And so that would be the Tier 2 type of patient that we would want to bring in here. The Tier 3 type of patient, as I mentioned before, is the person that you would see in a medical surgical bed in a hospital, on a regular hospital floor, that needs oxygen therapy, needs some intravenous therapy, and needs a little bit of more care than somebody that could go home. They're not ready to be discharged yet from the hospital, but they need a couple more days for treatment and recovery.
You had said volunteers will help staff this. I imagine it's a mix of retired folks coming back and regular doctors and nurses. Any sense of how many? And I guess that might ultimately depend on how many patients come in.
That's correct. It would depend on how many patients come in, and we are still working on the staffing right now. But the Medical Reserve Corps, who is an organization, it's a volunteer organization that's managed by the County Health Department, and they are a lot of retired medical professionals, as well as some active medical professionals belong to that. And then we're also looking and working with the hospitals to see if they have any staffing that they could provide to us for that kind of service as well.
And are there any other facilities like this in Bucks County right now, or this would be the first?
This would be the first. We're hoping that it's not needed, but we'll be able to surge 80 to 100 patients if need be.
I know you can't predict this with much certainty, but given the trends that you've been seeing, at what point do you think you would need to rely on a facility like this?
Well, the medical numbers, are growing slowly, but as people become positive, there are people that are healing up as well, and they're going off isolation and quarantine. At the rate that we're acquiring new COVID-19 positive patients, and at the rate that they're being hospitalized, we might be in pretty good shape and not have to use this facility. So it's really a waiting game to see when we think we're going to need this. But we do monitor the bed availability at the hospitals daily. We do talk with the hospitals on a regular basis. We know what kind of staffing they have. We know what kind of bed availability they have. And so before we get to that point of needing the facility, our hope is to ensure that it's ready and functional to go.
And which hospitals are there? I know St. Mary is down the road. And which other ones?
So we have St. Mary's Hospital, we have Lower Bucks Hospital, we have Jefferson Bucks Hospital, we have Doylestown Hospital, and we have St. Luke's Upper Bucks Hospital. So we have 6 hospitals here in Bucks County, and Grandview.
And could they potentially come from outside the county, or are you thinking right now just Bucks County?
Well, those are situations we'll have to look at to see if it's needed for us. Naturally, we want to lessen the burden of our own hospitals and take care of Bucks County citizens. But if the need arises and we can help, we'll surely help somebody else.
Is the county still working with the Army Corps of Engineers at the other 2 facilities?
Both other facilities were evaluated by the Army Corps of Engineers. The location in Lower Bucks County was taken off the list. The Upper Bucks County location is still being considered. It's on what I'm told as a short list. But the county commissioners and I believe that we should be proactive, and we should do what we think is needed for the residents, and not wait for someone else to make some decisions for us. If the state does choose the Upper Bucks County location to be opened, that will be a Commonwealth-supported site. The county will assist in getting that one ready too. But at this point, we think that we need to continue moving forward to ensure we have the capability to take care of our residents.
Are you running short in any supplies right now? I don't know if this is a good question for you or not, but I had heard just like anecdotally Jefferson was short of masks. I don't know if that's true or not. I'm wondering if you have any big picture on supplies.
So we do get shipments in from masks that the county purchases, along with other personal protective equipment, similar like gowns, face masks, face shields, all of those things that the healthcare workers or public safety workers would need to protect themselves to treat a COVID-19 patient. The county has purchased many of those, and we have received shipments from the Strategic National Stockpile. Could I tell you that we have enough? We get enough in the way of, it seems that we get a supply, or our vendors fulfill an order for us as a just-in-time shipment. So when our responders and our hospital folks are starting to run low, we get a shipment that we could get it back out there. But I will tell you, a lot of the personal protective equipment is still scarce, and it's still difficult to get. But we've worked very hard to get that in the County Emergency Operations Center.
Just to clarify, is this facility being donated, and is your department overseeing if there are patients here, or is your department overseeing who comes here? Or?
Well, the facility is being donated by Mr. Worthington, and it's a large venture of who's going to oversee this facility. I am not a doctor, and I don't run a hospital, but we have received guidance from two medical physicians, the one being Dr. Jerry Wydrow. He is the doctor for the Emergency Medical Services Council for Bucks County, and the other one is Dr. Damsker from the Health Department. The person that will actually be overseeing this facility as patients are here and being taken care of is going to be a medical professional. So that's the person that's going to be in charge. We'll make sure that the lights are on, it has the right equipment, it's set up, it's operational, and we'll support the medical folks that are here working, but I won't be the person that's the everyday decision maker about the care of people that are here.
Do you have any updated numbers in Bucks County at this point? Number of patients, I know that you had a Zoom I saw a few days ago. Just wondering if there's any updates on numbers or how the county's doing, just big picture kind of stuff.
We're at 824 right now on people that have been diagnosed. Is that right?
859.
859. See how it's changed since this morning.
So the county has 859 positive COVID-19 patients, and those numbers are changing constantly. As David Damsker would say, after this press conference, the number will be different. We have several dozen people who are hospitalized as of this morning. I believe that the number was in the low 50s, and we have about 12 people in the county that was in critical condition on ventilators. And as of this morning, we have 24 deaths.
Any other questions?
At what point do you think the facility will be completely open and ready to go? Obviously, understanding that you may not have patients coming in, but when do you think the setup will be complete?
I think the setup will be complete by the end of the week. But there'll be some equipment that we'll bring in right before the patients start to arrive. But 95% of the facility will be set up and ready to go.
Thank you very much. Thanks for being here today.
Thank you.